We're going to begin this hour with another big story, 2 years in the making, the emotional toll of the pandemic on healthcare workers after these 2 years of incredible stress. A recent study found that 1 in 5 nurses say they are burned out. Some say they struggle to eat, to sleep, and to stay healthy themselves. In a recent survey, an astounding 68% of nurses have said they considered leaving their jobs. We spoke with 5 healthcare workers all around the country about the stress they face while on the front lines.
Working in healthcare is definitely a marathon, and it seems worse now.
You don't get enough sleep, you're not eating, and you're working shift after shift. It's just exhaustion.
I might sleep for like 4 hours. I kept replaying the day over and over again. Did I turn this off? Did I do this correctly?
Thinking back to March of 2020, I did not think we would still be here now.
The ER that I work in, we have 50 beds that we can see patients in, and we are seeing our census at any given time is 100, so double what we actually have capacity for. I'll come home from work, and there's days when my scrub top is covered in sweat as soon as I'm walking out of work because we're hustling, the entire 12 hours.
You're seeing more death and dying than ever before, and that's hard. And we're people, we're humans, and we need time to grieve too. When you're busy and your hospital is bursting at the seams, you don't have that time. You just have to go on and take care of the next patient.
The burnout has been around the inability to get ahead of it. So in healthcare, we're so used to being able to get ahead of different things. And a lot of times we haven't been able to do that with COVID-19.
The most difficult part of during this whole pandemic for me has been losing colleagues and friends to different jobs or different opportunities or to the burnout itself. I have friends that have gotten completely out of nursing.
You've got a shortage of workers. You've got lots of people out because they're quarantining. And so you're having to pick up extra in overtime in order to take care of patients. We need more nurses in the workforce.
I got very lucky that my fiance does the same job I do. We work side by side every day. Every shift we work is together. It definitely helps to have somebody who fully understands what I'm going through.
I had that heart-to-heart conversation with my husband, and I told him that this is what I love. This is what I want to do, because I was on the fence of if I was going to continue with this.
All healthcare workers right now should reach out and be willing to open up to their colleagues, to their friends, to their families, that when they're feeling that burnout, we're so used to taking care of other people, we tend not to take care of ourselves as much.
Senior medical correspondent Dr. Narula joins us now. Dr. Narula, it's powerful interviews there with frontline workers. They're all experiencing some degree of burnout. What are the effects of burnout?
Well, I think it's important that we say a lot of people think this is a fluffy term, but actually in 2019, the World Health Organization created a diagnosis code for this, and they call it an occupational phenomenon. And the roots of burnout trace back to the 1970s when a psychologist here in New York City was volunteering at free clinics down in the East Village that were treating those with drug addiction. And he recognized in himself and his staff what was happening, that they were really giving so much of themselves, they were becoming emotionally depleted, and they were having a lot of the signs of what he termed burnout. He took that term from the addiction community. And then in the 1980s, another psychologist expanded on this, Christina Maslach, and actually created what's now a burnout inventory, the MBI. And that's how we grade it. And so we look at 3 main things. It's kind of characterized by emotional exhaustion, dissatisfaction with your personal accomplishments, and depersonalization. You're not connecting with your patients. The problem with all of this is that for healthcare workers, it really strips them. It colors their world, the way that they see things, the way they interact with the world. It takes away hope and interest and joy. And it sets them up for things like substance abuse, depression, suicide, problems in their relationships.
You know, it's been a couple of years. You first did this story a couple of years ago where you focused on the exhaustion of the medical community. I swear to you, Tara, I'd never even thought of that until you brought it to our attention. It hurts that 2 years later, we are still having this same conversation. So what can hospitals do? What can they do? What should they do to address what is happening to healthcare professionals and how tired and exhausted and burned out they feel, because we need them.
Absolutely. And it is a resource in our country that is depleted right now. And it was a crisis that existed before COVID. We know that 1/3 to 1/2 of healthcare workers reported burnout before COVID. Clearly, that has increased now. And I remember we interviewed someone a year or two ago, a healthcare worker, who said he feels like a rope frayed at both ends.
Yes.
There was a recent article about burnout that called it death by 1,000 cuts. And that's really what it is. You know, burnout, when you ask healthcare workers, a lot of it is the administrative burden, the bureaucracy of charting and paperwork. But then add to that what's happened this past 2 years, right? So they're overwhelmed, long hours, staff calling out, staff sick, and they're filling in. They had fear of being sick themselves or bringing it home to their family.
So what should hospitals do?
Well, hospitals need to play a role in this. The leadership needs to create positions like chief wellness officers. They need to create peer support groups. They need to create a culture where mental health is okay to speak up about, that people won't feel penalized for talking about it. And they really need to create resources, flexible schedules, even hazard pay and bonuses. So there's a lot that leadership can do, as well as individuals.
Yeah, another reason why we should check on each other, especially the heroes that work in healthcare.
That's right.
Thank you so much, Terry. You're the best.